اذیت و آزار کودکان به هر شکلی که هستش اشتباه است. حفاظت از کودکان وظیفه همه ماست. اذیت و آزار کودکی همونطور که گفتیم به اشکال مختلف اتفاق میفته و یکی از سخت‌ترین و زشت‌ترینش آزار اذیت جنسی هستش. من اینجا هستم با سوپروایزرم دان رایت که مدیر یک کلینیک رواندرمانی هستش که سالهای سال خدمات رواندرمانی به مردانی رسوندن که تو کودکی آزار اذیت جنسی شدن. من این کار فقط انجام میدم که بدونیم اذیت آزار جنسی فقط برای دختران نیست، برای پسران هم هست و وقتی که اتفاق میفته چه برای چه دختر و چه برای پسر سالهای سال عواقب روانی داره و فرد آشفتگی و پریشانی فکری پیدا میکنه. حالا دوست دارم که دان برای ما صحبت کنه. دان, talk about what kind of work you do here.
Okay, well, we do individual and group therapy for men that have been victims of childhood sexual abuse or recent sexual assault. And a couple years ago, we expanded our mandate to include men who are victims of domestic violence as well. But most are sexual assault victims.
So how would you describe or explain childhood sexual abuse in male?
Well, it's a range of experiences that come from a really subtle invasion of sexual privacy, I suppose, to all-out sexual assault, rape, that kind of thing. Devastating impact. Men carry these effects around for decades until they actually get help to overcome them. Depression, anxiety, low self-esteem, shame and guilt are a big one. Distorted boundaries. Either they have no boundaries whatsoever, they just cannot set a boundary around themselves, or they have such a thick wall of protection around them that nobody gets close. But pretty much all male survivors have a lot of issues around boundaries. And without clear boundaries, you don't really have a clear identity. So they don't really know who they are, what they're all about. Sexual orientation is a big confusion for a lot of male survivors. So suicidal ideation, a lot of addictions, drug addictions, alcohol addiction, sex addiction, workaholism, eating disorders as well. You see that more often with women, but certainly some men have eating disorders as well.
And over the years, our clients, they have been talking about the aspect of using drugs and alcohol to numb themselves.
Exactly.
To not feel the pain of sexual abuse.
Right, absolutely. They learn early on that their experiences are so overwhelming, they have no capacity as a child to deal with it, to make sense out of it. So anything that they can do to push down those feelings, those confusing, frightening, overwhelming feelings, and they learn early on that sex addiction, drug addiction, alcohol addiction are all ways to shut down those feelings. Without the tools or the capacity to resolve those issues, they live a lifetime of addictive behavior patterns to constantly keep those feelings pushed down.
So in our Middle Eastern type culture, it's very hard, it's kind of impossible to talk about sexual abuse, whether it's girls or boys.
Right.
So would you say it's the same here in Canada?
It is. I think it's pretty much the same everywhere. I mean, in some cultures where a very strong masculine image is more the norm, it's a bigger issue. In a culture where men are allowed a little bit more variation in terms of how they express themselves, not so much. But any male survivors feels that their masculinity has been reduced by the mere fact that they've been victimized. And some men actually feel feminized by the abuse. And sometimes the offenders treat them in such a way that furthers that idea of being not fully male.
So what's your advice to families whose their sons might disclose the sexual abuse to them, and how would they behave?
Well, it's important that the child be believed and that they feel supported and not blamed or held responsible in any way whatsoever. The appropriate response would be something like, I'm really sorry that happened to you. We're going to get you some help, and we will stop that person from hurting you again. And that might be a police report. It might just be making sure that person never comes around anymore.
So do you think, does it matter what age the child has been when sexual abuse happened?
For treatment issues, yes, because when the abuses happen early on,